be done during pregnancy? Now, this is one of the most frequent and common questions asked by many pregnant women in my clinic. Good morning, myself Dr. Ankita Mandal, consultant obstetrician practicing in Kolkata. Today we will be discussing about how many ultrasounds should be done during the antenatal course. Now many pregnant women, they are very apprehensive that why you are asking for so many scans. Does it going to harm my baby? The answer is no. We first advise a scan, a transvaginal scan or abdominal scan for the first trimester, which is called the dating scan. Now this is very important to know if your baby is in the right location or not. If there is any chance of any ectopic pregnancy, any risks of molar pregnancy, or what is the gestational age of the baby. And so it's very important to do the first scan. Ideally, it should be done by the transvaginal route because it is very sensitive and it helps us to date the baby. The next scan normally be advised from 12 weeks to about 13 weeks 6 days, which is called NT scan or the first trimester screen. This scan is very important to diagnose any chromosomal problem in the baby, like Down syndrome, Edwards syndrome and Tau syndrome. Now if there is no problem in this, then we normally advise the level 2 scan or the anatomy scan at 20 weeks. It can be performed between 18 to 22 weeks also. Now, the advantages of doing the TIFA or the level 2 scan is that it is a structural scan. We see every structural detail of the baby. Though few anomalies can again develop in the last trimester also, but maximum anomalies can be detected at this stage. Now, if this report turns out to be normal, then we advise another scan which is called growth scan between 28 to 32 weeks. But this is important to see the growth of the baby, like placental localization and fetal heart sound. And the last ultrasound we advise is between 34 to 36 weeks is color Doppler ultrasound. Now this helps us know the fetal well-being. So normally we advise all these ultrasound during pregnancy if it is not a high risk pregnancy. The frequency of ultrasound can change if you are having any high risk pregnancy, twin pregnancy, both in dichorionic and monochorionic pregnancy, if there is any history of preterm labor, if the patient is having gestational diabetes mellitus or pregnancy-induced hypertension. Thank you.